If you live with and suffer from autoimmune conditions such as Crohn's disease, rheumatoid arthritis, lupus, Hashimoto's, you may not know that a lot of the flares or symptoms of inflammation you're having are actually stemming from an imbalance of bacteria in your gut. We have trillions of bacteria that live in our gut, and they very much control what happens in the rest of our body and the level of inflammation that we have in our body. So if there's an imbalance in these bacteria, and if there's more bad bacteria than good bacteria, that can lead to inflammation and can actually even lead to autoimmune conditions. There's studies showing that there's a strong link between certain bacteria and certain imbalances in the bacteria in our gut and autoimmune conditions. Today, I wanted to discuss in a little bit more detail why taking care of your gut and understanding what is happening in your gut is so critical if you have an autoimmune condition. Because if these things are not taken care of, then the root cause for some of the flare ups that you're having or some of the symptoms that you're having will never be addressed. One of the biggest challenges with autoimmune conditions is that your immune system can become confused or overactive. And this can be triggered by certain bacteria in your gut. So the first example I wanted to talk about was a bacteria called Klebsiella. And this is a bacteria that lives in our gut. But if it overgrows and our immune system is trying to attack it to lower it, it can very much mimic what our human tissues look like. So then what happens is our immune system is attacking this bacteria. But at the same time, it can start attacking our human cells because the structure of this bacteria can sometimes mimic certain human cells. So then what happens is there's an overactivity of your immune system. Your own cells start being attacked. And this can lead to autoimmune conditions. There are also other pathogens in our gut that, when they come out of balance or become overgrown, can actually lead to inflammation and can lead to a compromise or a destruction of the structure of our gut lining. Two of the most common ones that cause this type of destruction in our gut are Candida, which is a type of yeast, as well as something called Enterococcus. When we have an overgrowth of these, what can happen is there can become a lot of inflammation in the gut, which can lead to something called leaky gut, which means that there's a separation in the cells in our gut wall, which then allow things such as toxins that are in our stool, but other inflammatory things that are in our stool to actually pass into our bodies, into our bloodstreams, and that can spread throughout our body and lead to inflammation in other parts of our body, such as our joints and our brain. Not something that we want happening, but there are certain bacteria and yeast that can lead to this process. There are even parasites, when left untreated, that can lead to continuing inflammation and immune activation in our gut, which can then lead to autoimmune conditions. One of these types of parasites is called blastocystis. And if this isn't treated, then that inflammation and some of that autoimmune and immune dysregulation that's happening from this particular parasite will continue happening. So how do we know if you have bacterial overgrowths or parasites in your gut that could be driving some of these imbalances, which then lead to autoimmune conditions? The best test to check for this is something called a GI map test. The GI map test, unlike like a broad stool test, which looks at all the bacteria in your gut, looks for specific DNA of very specific bacterial strains. And by using this DNA technology, which is very advanced, it is able to detect specific strains of specific parasites and bacteria, but also gives us a quantity of how much of these specific parasites and bacteria are in your gut. By understanding this, we are then able to come up with a specific treatment plan to treat that imbalance. The GI map test also looks for markers of inflammation. It looks at something called calprotectin, the marker of inflammation in your gut, but it also looks at how your immune system is active in your gut. It looks for something called secretory IgA, an antibody made by the lining of your gut. When this marker is elevated, that could indicate an inflammatory or infectious process that's happening in your gut, which could be driving some of these inflammatory changes, which could then in turn drive your autoimmune condition and your flares. So how would we go about treating these types of imbalances once we find them? The first thing we usually want to do is we want to remove whatever infection is there if we can. And so there are more natural ways of treating infections in your gut by using things such as oil of oregano. There's a specific compound of garlic that I like to use at times, which is in a supplement form, as well as things such as berberine, which could be anti-inflammatory and can actually help to manage your metabolism as well. So that is usually the first step. The next step is to then rebuild the gut lining. I do that using supplements that have certain amino acids, certain proteins, which help to rebuild the gut wall in certain places. And then later on, we rebuild the good bacteria. So after we've eliminated some of the bad bacteria, we work on rebuilding the good bacteria, and that starts to bring everything into balance. So some supplements that could be good for this are things such as oil of oregano, berberine. There's a specific amino acid called L-glutamine that I like to use to help rebuild the strength of the gut. This has to be tailored to whatever infection we find, and the specific treatment has to be adjusted based on your symptoms. So one case example of how I've helped a patient who has an autoimmune condition is a patient I had with Crohn's disease. She was suffering with terrible flares, was on steroids for a long period of time. She was also on biologics, and nothing was helping her. She was still having flares in between, and she felt really bad. The medications that she was on were causing her even more side effects. By doing the GI map test, I was able to identify a mix of a particular type of bacterial overgrowth along with a specific parasite that she had. And we used a certain antimicrobial regimen to treat that. Then we put her on a regimen of very specific probiotics, berberine, as well as some other supplements, and her symptoms got better. She's actually off of her biologics now. She doesn't need steroids in between for flare-ups, and she has absolutely no flare-ups. This is a great example of how functional medicine can help you if you have an autoimmune condition and you're really looking for what the root cause is of that condition. Thank you for listening today. If you have any questions or you'd like to schedule a discovery call, just reach out to us.